So here's the agenda at a high level. We're going to talk about Biden's moonshot and what we're doing here locally. I'm going to share a little bit about the coalition's new structure. Sarah's going to provide updates on the regional cancer networks. And Liz, our marketing and communications consultant, is going to share our year in review. Ryan Kerr is going to share the Employer Toolkit, and then all of the task forces will share their updates, and then we'll end with some speed networking, just like last time. So before we jump into this, I do want to welcome our new vice chair, Shanna Owen. So do you want to come off mute, Shanna, and introduce yourself?
Yeah, can you hear me?
Yep.
Great. Yeah, hi everyone, I'm Shanna Owen. I am currently the Director of Oncology Services at Swedish Medical Center. I have been with Swedish for almost 12 years now. I've held various roles with them, starting with staff nurse through critical care ICU and perioperative services director for the past 6 years. I've been with oncology services now for a year. And I'm very excited to join the Colorado Cancer Coalition and help, break down barriers for patients with oncology needs. So thank you for the welcome, and I am so excited to meet all of you and get to work with you.
Great, thank you. We're glad to have you on board.
Thanks.
Okay. All right. So I know most of you have probably seen in the news Biden's moonshot. And so I wanted to take some time today to just share a little bit about the moonshot and things that we're already doing here at a local level that are helping address his goals at the national level. So the big goal is to end cancer as we know it. So to reduce the death rate from cancer by at least 50% over the next 25 years, and improve the experience of people and their families living with and surviving cancer. And as all of you know, I like to share and remind you all that in Colorado, cancer is the leading cause of death. In most states, that's not the case. And so we really do all need to work together to help save more Coloradans from being diagnosed with cancer, living with the long-term effects of cancer, and then also try to reduce that death rate in Colorado here from cancer. So part of the moonshot, there are 7 pillars, and they align a lot with the cancer plan. So the pillars are to diagnose cancer sooner, prevent cancer, address inequities, target the right treatments to the right patients, speed progress against the most deadly and rare cancers, including childhood cancers, support patients, caregivers, and survivors, and to learn from all patients. And so all of these pillars can be found in the cancer plan, either in some of our goals or in some of the strategies. And so we're on the right track to help move this moonshot forward, and also to just move our cancer plan forward here. The president has put together a cancer panel, and I wanted to just highlight what those priorities are again, and how we're addressing that here. So one is improving and aligning cancer screening communication. And part of that is to develop effective communications. And so especially with Liz's help now, you'll get to meet her shortly, we've been putting out our monthly newsletters. We've been more active on social media. We put out various toolkits that the task forces create, and we share other evidence-based toolkits that have been created. We are putting the regional cancer networks into place, which will be a great avenue for getting information outside of the metro area and into the rural and frontier communities. And we've put together the Employer Toolkit, which we'll show you later today too. The next piece, expanding and strengthening national cancer roundtables that include a focus on cancer screening. As most of you all know, Colorado is seen as a leader in cancer care and prevention. And so we're lucky to have representatives on the National Navigation Roundtable, the National Lung Cancer Roundtable, the National Colorectal Cancer Roundtable. And Allie just shared yesterday, they're starting a National Breast Cancer Roundtable in August. And so hopefully we'll have a Colorado representative on that down the line as well. And what this also looks at a local level, you know, we've got our task forces, our new regional cancer networks. And so we're really helping be that convener here locally to share best practices and provide those networking and education opportunities. The next piece in the cancer panel worked on is facilitating equitable access to cancer screening. So those two goals, provide and sustainably fund community-oriented outreach and support services to promote screening and follow-up. Some of the things that we've done, the free colorectal cancer screening days out in Fort Collins. The Sun Bus is getting back out there into the community, and the Skin Cancer Task Force is getting the Reveal Imager back out into the community now that it's safer-ish to be in public. And so they're having outreach events. We're planning a cancer spectacle at the state fair, and at the cancer spectacle, we'll have inflatable lungs that you can walk through with a virtual reality experience, an inflatable colon. We're still working out the breast angle, if it's either going to be a mammo van or ridiculous inflatable boobs to make it even more of a spectacle. What else will we have? Like quitting tobacco information. It's going to be a huge cancer prevention and early detection spectacle that you can walk through and have a lot of fun. And then we've also been working on employer policies and helping employers increase their cancer screening rates among employees. The next piece is the increasing access to self-sampling for cancer screening. Some of the cancer plan, we've had some cancer fund grantees who've worked on FIT screening and things like that. But I put a note here for, you know, as self-sampling for cancer screening becomes more prevalent, what else can we do here as a coalition to address, you know, the barriers of people that don't want to come in for a pap smear and people that don't want to come in for a colonoscopy? What else can we do here in that space? The third one is strengthening workforce collaborations to support cancer screening and risk assessment. So here, empowering healthcare team members to support screening. There's various partners doing clinic quality improvement initiatives. We also host ad hoc webinars and continuing medical education on initiatives like this. And then the second part is expand access to genetic testing and counseling for cancer risk assessment. So we've supported some policy changes in this arena. We're working with the CPCRN, and I'm not going to be able to remember what that acronym stands for. If somebody wants to put that in the chat. But CPCRN is doing some mini grants in the genetic space right now, and so helping assist with that process. And then another exciting thing, like the cancer spectacle, we are working on putting a chat bot together that if you land on the coalition's website, the chat bot would start to engage with you and ask you like what resources you're looking for. And we're working with the mHealth Impact Lab at the university. They've been doing this in the in the cardiovascular, they've been doing it in another chronic disease space. And so we're tapping into their expertise for the conversational messaging and making it engaging. And we will be putting the support group lists and the maps from the cancer map, the resources from the cancer map all into the back end of this chat bot, so that as somebody's engaging with it, they can hopefully find the resources that they're looking for. And ultimately, if they can't find the resources they're looking for, get to a human who can then connect them to a social worker or a financial counselor or a navigator to get them to the resource that they're looking for, to get them to a cancer screening, to get them to a genetic counselor. So this is coming soon. There will be a version of it up by the end of June, and then we'll just be continually refining it from there. And this is the last one, creating health information technology that promotes appropriate cancer risk assessment and screening. So again, the chatbot comes into play here, just helping automate things. We know there's not enough navigators out there to meet the demand So how can we use technology to help people get the resources they need? And then the last one is creating and deploying effective clinical decision support tools. And we work with partners like the Colorado Cancer Screening Program to help with things like this. And then I put another note here, what else can we do in this space? I'm gonna pause and just see if anybody has any questions about how this plays out here in Colorado, or has any ideas on either like the self-sampling piece or the clinical decision support tools, or just any ideas on what we've gone over so far.
So Christy, in addition to the new breast cancer roundtable at the national level that will launch in October, ACS is also starting a cervical cancer roundtable. I'm not exactly sure when that will launch, but one of their main focuses will be self-sampling and at-home testing. And so I think there'll be more to come about potential ways to implement strategies for that from that roundtable.
Awesome, thank you. And sorry, what timeline did you say that one was starting?
I don't know.
Okay. All right, well, great. So hopefully we'll have some Colorado representation on that roundtable as well. Any other questions or thoughts? Okay. Oops, I think I went one too many. Okay, I'm actually, Allie, I'm gonna keep it on you and let you talk about the new structure for the steering committee of the Colorado Cancer Coalition.
Yeah, so as you can see, and as you'll hear throughout the rest of this meeting, we're doing a lot, and we're growing, we're getting new task forces. And so the leadership team really thought that this was a great opportunity to do a little bit of restructuring with what we have historically called the steering committee into a more traditional board of directors. So we will be transitioning to that model after this meeting. I think this is kind of our official announcement here. But thinking about, as we are growing, what expertise do we need? Obviously, we need money to implement these projects. We've worked on some policy strategies. We have Liz to help with communications and marketing, but certainly we could use more expertise in that arena, thinking about a lawyer's thoughts on different projects as we're getting into things, accounting, how are we keeping track of all of these different grants, and then just general expertise. So there is a form that you can see on the slide, and then also I'm sure that Christy will be sharing it more broadly about ways to get involved. So if you know somebody that would be interested in being a director on the board, and that whether they work professionally in a cancer space or just have expertise and care about cancer, we're looking to really build this board out. So if you go to the next slide, Christy. So these are some areas that we're also looking for participation in. So we're fortunate with Anashe as the chair and Shanna as the new vice chair to have some of that oncology expertise as an oncologist and also as a navigator. which is really exciting. But these are some other people that we think could also be really helpful to the coalition. So yeah, that's kind of that. And then if you go to the next slide, Christy, this is kind of what the structure is going to look like. And so we can see that we have the elected leadership with Anna Shea as chair and Shanna as the vice chair, and then me as the past chair. And then we have a requirement from CDPHE with some of the funding that we get to include folks from some different CDPHE programs that you can see. And then we will be adding those 9 board members or directors with those kind of expertise and thoughts and leadership qualities that we're looking for to really move the coalition forward. So we're excited about this. I'm sure there will be a little bit of growing pains as we are getting folks oriented and onto the board. So stay tuned. And Christy, there's a bunch of questions in the chat that I'll let you tackle.
Sure, thank you, Allie. Okay, so the first question that came through was, do you have to be an existing member, and what other requirements? There really are no requirements. It's just an interest in joining the board and helping us continue to grow. So no requirements there. And then the other, what type of attorney? Nothing in particular, just somebody that we could tap into if we needed to, and again, with an interest in cancer that wanted to help the coalition expand. And then I wanted to say the form and the board of directors commitment document are also available in Spanish. And so when we send out information after the meeting, I'll be sure to include both links so that everybody can access it. Any questions? Any questions on the new structure?
So Christy, just a couple other comments. If you could you put the form in the chat? Somebody direct messaged me and asked for that. And then there was one other comment about including nurses, and certainly nurses across the cancer continuum would be welcome as board members. I mean, it's exciting to have Shanna, who's a nurse, as a part of the leadership team, and certainly, yeah, nurses across the cancer continuum we would love to have as a part of the board.
Yep, great, thank you. And yes, I will get that into the chat shortly once somebody else is speaking next. Let's see. Okay, I'm gonna turn it over to Sarah to talk about the regional cancer networks updates. As you all know, in January, we gave you a teaser to it, and there's been a lot of development. So I'm super excited to have Sarah share where we are now.
Thanks, Christy. Yeah, so for those of you who don't know me, I'm Sarah Roberts. I work with the University of Colorado Cancer Center in the Office of Community Outreach and Engagement, and I also co-chair the Colorectal Cancer Task Force for the coalition. So just an overview or kind of a background of.
Just go a little slower.
Oh, yeah, thank you. So just a reminder for people who weren't able to join the call in January. This is a partnership where we're helping to implement evidence-based interventions across the state to reduce the cancer burden. So it's an NCI supplement. It's a collaboration with the University of Colorado Cancer Center, the coalition, and CDPHE. So our couple of aims here. Our first aim is to convene these regional cancer networks to help the infrastructure development to support these evidence-based interventions. And these evidence-based interventions are going to be in line with the priorities of the specific region and also aligned with the Colorado Cancer Plan. So then our second aim is to facilitate projects or these evidence-based interventions to study different ways to help with cancer prevention and control in these specific regions. And we will help do that by partnering the regional cancer networks with investigators to conduct these pilot projects across the state. And I think we can go to the next slide, please. Thank you. So here's a a nice drawing essentially of a map of the regional cancer networks that we are working off of. So our goal is to have 6 regional cancer networks across the state. The coalition has a lot of representation in the Front Range, which is that purple outline. So our goal is to try to build, and we've established, already we've established 4 of these 6 regional cancer networks. So we have the Southwest region, the San Luis Valley region, the Southeast region, and then the North sort of like middle central East central region as well. You can go to the next slide, please. I guess I could have said it on the last slide, but one thing that we wanted to make sure that people know is that the region borders are fluid. That's why they're hand drawn using the Word document version, but it doesn't have to be like hard and fast that those are the specific regions. But here's a list of who is supporting each of the regions and leading the regions so far. So again, we have the 4 established. Southwest Colorado, that region is being led by the Cancer Support Community of Southwest Colorado. Eastern Colorado, or the East Central, is covered by Cheyenne County Public Health. Southeast is being led by Otero County Public Health. And then what we just heard today was that San Luis Valley has confirmed as well. So we're also trying to establish the Central Mountain region, and then hopefully the Northwest and Northeast regions as well. Go to the next slide, please. And then I think this was an update that Ashley was going to provide, right, Christy?
Yep.
Perfect.
Hi, everyone. Good morning. I'm Ashley Libby Diaz. I'm the lead of the Southwest RCN. And we just wanted to share some progress with you all that we've made. We are still in the early days, but getting going, certainly thanks to the help of Christy and Sarah. So we did, at the end of March, we hosted a kickoff call. We had more than 10 attendees at that meeting who are all interested in joining. We have quite a large region in Southwestern Colorado. We were thrilled to have people from Grand Junction with us, from Pagosa Springs, certainly from the Durango area. And as we continue to build our Southwest RCN, we are looking to ensure we have representation from across our region. Also, what was really exciting to see is that we had such a diverse array of people. Tony Abbey, Cancer Support Community, Southwest Colorado's executive director, was able to reach out to people from all sorts of backgrounds. We had people involved in pediatric cancer and who lead cancer programs in their regional hospitals. We had a naturopath who specializes in oncology represented there. So really great to see a lot of people interested and different voices around the table. We have also, thanks to Sarah's help, we have a one-pager for additional recruitment so we can continue to get more voices involved. At this stage, we are conducting a survey to determine the priorities for our region, looking at the types of cancer we may want to study or focus our efforts on, looking at disparities in care that may need our attention in our region, and then also taking a look at what strategies folks in our region might be interested in pursuing to close some of the gaps, or perhaps I should say, move us along. So really, really thrilled at the progress we've made in the last couple of months, and looking forward to what's ahead in our region and supporting those in our community. Sarah, Christy, anything to add?
Just thank you for getting it up and going and getting it off the ground.
Thank you. Thanks for the opportunity.
Can I ask a question quickly? This is Becky. How do folks get involved if they're interested in joining this RCN or others?
Yeah, we can pop an email address in the chat, I think would probably be the best way, or a couple of email addresses. We are certainly still looking for more people and more voices. So also happy to share that survey link with those in our region. So first step, get connected, and then we'll do some follow-up from there. Happy
And,
to answer any other questions if there are.
and we just put up a regional cancer networks page on the coalition's website. And so as priorities are developed and the one pagers are all created, we'll be populating that there so that people can get in touch that way as well.
Yeah, and I'll
Thank you.
put my email in the chat if anyone has questions about it or wants to get involved in any of the other regions aside from the Southwest region. But yeah, happy to answer any questions as well.
And this was all kind of said organically. Just let us know if you have partners to get involved with these regional cancer networks. And yeah, it's a great way to have little mini networks so that you all can really network with people that are closer to you, and also get connected to the broader coalition statewide. So more to come as all of these networks get going. I'd love to see task forces go to some of these regional cancer network kickoffs and things like that, especially as they figure out their priorities. We can get the task forces involved if it relates to their task force. Okay, I'm going to turn it to Liz now. So Liz is joined the coalition in October as our marketing and communications consultant. And so all of the social media that you've been seeing and this document that she's about to share, she's been the work behind the scenes on that.
Hi all. We're really excited to be sharing the 2021 year in review. We've been working on it for a while. It's a great opportunity to celebrate successes throughout each task force and through the coalition. And it's a tool you can all use to get more people in your community involved, whether that's through a task force or other ways within the coalition. I'm going to go ahead and share my screen so we can kind of look at some of it together. It goes through, there's a table of contents and a page on all the leadership and steering committee and all those that are involved with the coalition, as well as who the coalition is and some of the services that we provide out in the community. There's links kind of on a lot of the pages, which people can use to get more information. This page is great and connects to ways to engage with the coalition, whether that's joining a task force, being a sponsor. There's links throughout this page as well to click directly or to type in the whole website. There is the page, the new regional cancer networks page, important dates throughout the year, and then links to get involved if you're not on the list or have support groups. It highlights the new resources in Spanish, as well as the cancer resource map that's now also in Spanish. The document then goes on to kind of highlight all the task forces, the new task forces that were started last year, the Clinical Trials and Treatment Task Force and the Latino Task Force. And then there are a few pages for each of the already established task forces, highlighting information such as why to join the Cancer Task Force, their 2022 goals. It goes over the member organizations and individuals that are involved. Each page highlights the 2021 successes and achievements that each task force is proud of in 2021. And then there's a link on each task force page to either join or get more involved. And then it's kind of cool too, there's most of the pages also have some like educational information specific to that task force. The Lung Cancer Task Force also highlights some results from the symposium that they had last year. It goes over what attendees plan to do with the information they learned and some key takeaways. So all these are great tools for all the task forces to be able to use as recruitment opportunities. And if you're interested in getting these as one-pagers to put out and don't want to send out each individual one, let me know and I can remove the page numbers at the bottom, so then it is just a straightforward document that you can send. Towards the end there, we go over some of the highlights from the 2021 mini symposium, and then 2021 by the numbers. So this is a great page that really highlights some of the achievements in the past year that the Cancer Coalition was able to get to. So there are engagement statistics and data, really wonderful numbers for all the hours that volunteers dedicated to the mission of the Cancer Coalition. So we're really grateful for all of that time and effort. There's information on the social media impressions and how that's kind of been improving over the past year, and then how much money was raised last year through the Cancer Fund. The last couple pages, we go over all and thank all the sponsors. All of those images are linked to the sponsor pages, and then the last page has all the links to the coalition social pages. So it's a really great document. It's available on our website. I think there was a link in the slide, and then we can probably put in the chat the link to our website, but it's under the programs and events tab, and then Colorado Cancer Plan and Cancer Plan Progress. So you can either download it there, or again, if you want specific pages, just please reach out and we can send this to you individually.
Thanks, Liz. Any questions on the year in review? Okay, all right, I'm going to go back to sharing my screen. Except for my toolbar went away and I don't know where it went. 1 second. Does anybody know how to bring your Zoom toolbar back if it's disappeared from all your screens? Okay, here we go. Okay, can you guys see that? And I'll put it in slide mode. Okay. So I've shared a little bit about some of the updates we have, but I just wanted to highlight a few other ways that we've been implementing the cancer plan recently. So on February 4th, we had World Cancer Day, and this year we had a few sponsors come on board to really help elevate the conversation and get the word out more about with all the stories. So I think we shared about 20 different stories on World Cancer Day this year, and we'll look at doing that again next year. We also did the Healthcare Decisions Day. We got a proclamation this year. Thank you, Sandy Priester, for helping us get that proclamation. And that's just to really help make sure that people are putting their advance directives and making other healthcare decisions in advance so that their families know what their wishes are and don't have to have those conversations when it's too late. Did I skip? Okay. We're continuing our coalition and communities work. Some of the ways we've done that throughout the community are the free colonoscopy screening days in Fort Collins, the upcoming cancer spectacle at the state fair, and also tomorrow, Sarah Roberts will actually be out in Cheyenne County with Autumn Pelton from the East Regional Cancer Network. They're going to be at Farm Safety Day talking about sun safe practices and showing the students what sun damage can do to your face and looking at UV beads and things like that, and really helping elevate the conversation in Cheyenne County so that these kids can learn all about sun safe practices from a young age. And so we'll have updates from that at our next meeting. But we are always looking for opportunities to get out into the community, to do outreach, and just help support what you have going on. So if you have things going on in your communities where you want support from the coalition, please reach out to us. And we're happy to see if we can get a task force out there, get the Reveal Imager out there for sun safety. So just communicate with us and we'll do our best to make it happen. I am going to turn it over now to Ryan Kerr to talk about the Employer Toolkit that was created by the Colorectal Cancer Task Force and the Colorado Department of Public Health and Environment. So Ryan, I will turn it over to you. Oh, we can't hear you, Ryan.
I got muted again. How about now?
Now I can, yeah.
Awesome. All right. Good almost afternoon, morning, everybody. Thanks for giving me a chance to chat briefly with you. This is a pretty important topic for me and the group that I worked with in helping build this. So the kind of the origin of this was when we look at how do we improve screening rates in the state of Colorado. A lot of times you have to follow the dollar, and generally speaking, employers are the ones that are footing the bill for or a portion of the bill for insurance for their employees. And we figured there's definitely interest in some employers in lowering their costs of care, which would lower their premiums for their employees. And we've had some inquiries that kind of prompted this, going back as far as I think 2017. Our group presented at a kind of a coalition on health in the state of Colorado for employers. So what we decided to do was to build a toolkit that had information in it that could help, whether it was an HR professional or somebody at an organization that was trying to get their executive teams to agree to implementing some new policies or different types of interventions. And we wanted to give them kind of some actionable information, some templates and so forth. So really, the purpose of the toolkit is really to give that those different mechanisms to help someone develop, whether it's just individual policy or a full-blown screening program for different cancer screenings for their employees. And in there, we can kind of go to the next slide if you'd like, Christy. But in there we have kind of some cancer cost publications that are out there publicly that speak to the costs of treating cancer in the workplace, whether it be from direct costs of treating or if it's somebody missing time, somebody's at work but not mentally at work. I think it's called presenteeism. So it really helps them build a case so they can go and try to implement something. And then some of the other items in there are like templates. So if you want to implement a policy that says you can take a day off or half a day off to go get screened for a cancer, or even potentially implement to go help a loved one get screened, or a dependent in your plan get screened. So we have some of those things, letters from whether it's HR or a CEO that highlight the importance of screening and so forth, and how you should go about talking to your healthcare professional to figure out what the right screening options are for you. But there's really the point here was we'll have the whole gamut of people that are interested in implementing very robust screening versus ones that don't want to take a very strong stance but are interested in promoting at some level. And so we wanted to give them kind of a whole different amount of options for them to choose from to try to either build upon or even take and copy and paste and implement into their organizations. To date, we've spoken with a few different employers across the state of Colorado. We're always interested in having conversations if there's ever anyone on this meeting knows of an employer, whether it's a 5-person company or a 500-person company, whatever the sizes are. We have group members of the different task forces that have all said they'd be willing to help walk someone through some of these items, or just have a general conversation about screening programs and You know, a lot of times we offer advice to go talk to your benefit consultants, because a lot of the larger companies have those type of groups, but we arm them with, here are the questions you should go ask those people and what you should be thinking about when trying to shape and build something. So this is available on the Cancer Coalition website in the employer resources section, so you look through that. This is not meant to be a static document. We intend over time to add to it. There are a lot of great organizations out there that have similar types of toolkits that even as recently as a couple of weeks ago, I saw some things that I think will be great to add to ours that are good links for social media campaigns and so forth. So yeah, it's a great tool to have in the bag for us. So when we have those conversations, especially when we talk to organizations that are in the provider world, right, delivering care to patients, but they're also employers. So they are some of the groups that we also talk to about this, and thinking not just about their patients they see, but also about their employees. So I appreciate the time here today, Christy, and if there's ever any questions, feel free to reach out.
Thanks, Ryan. And as he said, we have people that are willing to come in and talk to employers. And so I've linked the toolkit, as well as on that page, there's a form. So you can share that form with people if they're interested in having conversations around this. So thanks again, Ryan. All right. It is time for our second poll question as we move on to task force updates. Oops. So Becky, you want to launch that second poll question, please?
Just launched it. Give it a few seconds. All right, 3 more seconds and then I'm going to close it out. All right, so we've got 45 people participated, 78% said yes, and 22% said no.
All right, thank you. My hope is that next time we do that, 100% will say yes, and that hopefully you'll find a task force that aligns with your interest. So we'll have them all provide their updates now. They're all going to share their goals for the upcoming year and some of the things that they've been working on. And so I will turn it over to, let's see. Is Lisa here? Okay, I don't think, okay, Lisa's not here today. So we have a newer task force, the Clinical Trials and Treatment Task Force. We've never had a task force in this, solely focused in this space, to my knowledge. We've started to get this one going. They've had one strategic planning session to talk about goal 6 of the cancer plan. And they're working on setting up their second meeting to talk about goal 7, which is all around clinical trials. Their email address is here. It's treatment@coloradocancercoalition.org. So if you're interested in joining this new task force, you can email them and get on the list. I do want to share a few other things we're doing in this space. We've been working with Lilly Oncology on examining biomarker usage in Colorado. And Colorado is a state that generally has coverage for biomarker testing, but the actual utilization and number of patients getting biomarker testing is not as high as it could be. And so we've had a survey out in the community to look at what are the barriers? Why aren't patients getting biomarker testing? Is it a physician knowledge issue? Is it a workflow issue? Is it just an overall kind of awareness issue? And so we've been excuse me, let me go to the next page. This survey's out here if you want to fill it in and help inform these efforts. From this, the Clinical Trials and Treatment Task Force will put together some educational opportunities, either like peer sharing opportunities or CME opportunities to help address these gaps and figure out how to get patients the best treatment that so they can have the best outcomes. Any questions for the Clinical Trials and Treatment Task Force? They don't have a standing meeting date yet, but when they do, we'll be sure to start putting that out into the newsletter. Okay. Ian and Sarah, I will turn it to you all now for the Colorectal Cancer Task Force.
Hey, good afternoon, everybody. I'll be talking today about CRC Task Force updates and what we've been working on. Yeah, you met Sarah Roberts earlier. I am the other co-chair of the CRC Task Force. So right now, our task force is finalizing our work group and task force action plans. The work groups have been selected, and the first one is focused on reducing structural barriers and partnering with community-based organizations to reduce those barriers to obtaining CRC screening. And it aligns with, you can see, we're trying to align our work directly back to the cancer plan. So you can see we're working on section 5.2 and activity 2. And you can see when these work groups meet. So if this interests you, you can contact Sarah or I, and we can get you connected. The other work group is focused on awareness and promotion, and they're working on promoting all modes of colorectal cancer screening to providers and individuals. They'll focus on general promotion, and also we want to identify and connect with a community with disparate screening rates to work with. The awareness work group has previously focused on getting a governor's proclamation and lighting several buildings around Denver metro area blue, and is also connected with a Spanish-speaking GI provider to interview on a local Spanish radio station about the importance of screening. They'll continue to do that, as well as focus on these other efforts. Next slide, please. Finally, or not finally, there's another slide after this. We held our third pro bono screening day in March. This focuses on patients who have had a positive CRC screening stool test, like a FIT test, but they're uninsured and can't afford the necessary follow-up colonoscopy. So we were able to screen 9 patients. No cancer was found. And this was a huge group effort. We worked with the Surgery Center of Fort Collins, who hosted the day, and Theetta Stewart. Dr. Davis Blanton performed the colonoscopies, and Danielle Billings helped coordinate the referrals of all the patients with the health centers that we worked with. And then Missy Wright with ACS helped also coordinate the day, and ACS also provided some of the funding for this, all the funding for this. And we're continuing to work on how to make this more sustainable. And hopefully we'll have another one in the future. Next slide, please. And so finally, we're coordinating, our task force is coordinating with the Survivorship and Palliative Care Task Force on bringing a webinar series to Colorado around food access and built environment. It focuses on highlighting goal 2 of the cancer plan, which is increased prevalence of healthy behaviors. And the first 2 webinars were focused on food access in urban and rural Colorado. Those were held in, I think, November and February. And then the final 2 will be focusing on urban built environment and rural built environment. And we just selected the dates for those, which are June 22nd. And then the rural built environment will be the topic for the coalition's July peer sharing call on July 20th, and more information about registering for those will be coming. And that is what we have been working on.
Thanks, Ian. And I just put the link to the recorded webinars in the chat. And there's a video from the free colonoscopy screening days. So I'll be sure to, that's on our YouTube channel. There's a lot of videos on our YouTube channel. So if you haven't checked out the Coalition's YouTube channel, check that out sometime you have some spare time to see all the great work that you all have been doing all across the state. Okay, next we have the HPV Task Force. So Jenny, Ashley, and Kate, I'll turn it to you guys.
Hey, everybody.
Oh,
This
sorry,
is
go ahead.
Jenny. Oh, no, Kate, if that's you, please go ahead.
Okay, yes, sorry. I think my view on my screen is kind of hard to see, but if you can see me, that's great. I will just go over a few updates from the HPV Task Force, and then I'll turn it over if you all have any others. But we have solidified our action plan goals. So our first goal will be to initiate 3 new collaborations with other organizations leading HPV vaccination-related efforts. So these will primarily be with the Alliance for HPV Free Colorado, health profession schools, community-based organizations, and youth organizations, and a few other groups. The other goal is to, by June of 2023, host and support a minimum of 2 education or awareness building events in a minimum of 2 prioritized rural or frontier communities. So we solidified those goals with our task force this month. And we also have a few collaborations that are just starting now. They include some work with youth organizations, and also a lot of work collaborating with the Alliance for HPV Free Colorado. The Alliance is trying to expand their reach out of their primary counties in Colorado, and with a few members of our task force, we're going to be able to expand that work out. That will be primarily with like quality improvement projects in school-based health centers, and then also with provider education sessions. I think Ashley or Jenny, do you have anything else to add here? I think we covered a lot in our last meeting. I just don't want to miss anything.
I saw Jenny give a thumbs up.
Okay, great. Awesome. Well, thank you.
Thank you, Kate, and thank you, HPV Task Force, for all your work. Okay, what time is it? 12 o'clock. And I told Emily she would be after 12 o'clock. So let me just make sure Emily is on.
Christy, I'm here.
Okay, great. Perfect timing.
I know, this worked out well. My son actually listened this morning in the transition. Good afternoon, everybody. My name is Emily Cervical. I'm one of 6 representatives of the Latino Task Force. I have a few colleagues here today that are going to help explain certain pieces of the presentation, because as you know, it takes a group effort to really explain all the activities that are happening within the community. One thing I did want to point out too, and we'll get to this in one of the slides down below, but we did come up with a Spanish name as well to represent, since we are focusing on the Latinx community. It's Grupo de Cáncer Latino. And so if you can advance the next slide, please, Christy. So I thought for those that were not here in January, as well as a refresher, because I believe we're one of the youngest new task force or baby task force members, right, as I like to say, that have joined. And so who we are as of right now, this is going to continue to evolve, right, as I've been listening to the work since January of the other task force leaders and their groups. So our group is comprised of women leaders, caregivers, cancer survivors in Colorado. We're seeking to identify how to resolve the cultural gaps that continue to affect the Latinx and Spanish-speaking populations in specific areas: access to care, behavioral risk factors, mortality, and overall quality of life. Could you please advance the next slide? And I am going to pass this over to one of my colleagues, Patricia Granados. She can kind of explain, this is a representation of some of our leadership and some of the boots on the ground that are doing the work that's so important to the Latinx community. Patricia, are you available to speak to this?
Claro que sí, buenos días, buenas tardes. ¿Sí me escuchan? ¿Sí? Ok.
Sí, Patricia,
Muy
la
bien, mi
escuchamos.
nombre es Patricia Granados. Soy también sobreviviente de cáncer y yo participo como coordinadora del grupo de sobrevivientes de cáncer en español. Este grupo se formó en el 2016 en el Hospital Penrose Centro de Cáncer en Colorado Springs, por primera vez en español. Actualmente es el único grupo de apoyo en español aquí en Colorado Springs. Bueno, pues nos iniciamos con un grupo de mujeres, como ustedes ven ahí, aunque también hemos tenido hombres participantes. Nosotros nos reunimos cada lunes, cada tercer lunes del mes, de 5:30 a 7 de la tarde. Ahí nos reunimos, actualmente pues lo estamos haciendo por Zoom, por esto de la pandemia, ¿verdad? Pero ya próximamente en junio, ya el Hospital Penrose Centro de Cáncer ya nos dio luz verde para reunirnos personalmente. Entonces aquí pueden ver unas fotos donde estamos, ¿verdad? Nosotras, ¿sí? Sí, es el Hospital Penrose Centro de Cáncer. Como ustedes ven, somos un grupo, de repente somos un poco más, las mujeres que participan, de repente llegan un poco menos, pero siempre lo hacemos con mucho entusiasmo y mucho cariño. Estamos ahí. La coordinadora principal es Cecilia Velardi, que ella trabaja en el hospital, en el centro de cáncer, y hablamos, ¿verdad?, sobre temas de salud, damos los recursos que la comunidad necesita saber. Ellas participan dando su testimonio, al igual yo, también como sobreviviente. Participamos, hablamos de cómo nos sentimos, cómo vivimos ese proceso del diagnóstico de cáncer. Ahí lloramos, reímos. Cuando nos juntábamos personalmente comíamos muy rico también, y ya lo vamos a hacer próximamente. Es algo que ellas pueden llevar también a su familia, porque es un grupo que invitamos también a la familia para que conozca lo que es el cáncer, para que ellos conozcan el cómo nos sentimos cuando tenemos este diagnóstico. Entonces, pues aquí estamos, nos reunimos, como les repito, cada tercer lunes del mes, de 5:30 a 7, y estamos siempre muy contentas y siempre animando a la comunidad hispana de que vengan, de que se unan a nosotras, de que compartan sus experiencias y de que el cáncer se puede sobrellevar, ¿verdad? Siendo un sobreviviente. Yo tengo más de 20 años sobreviviendo a un cáncer, y que podemos vivir una vida plena y feliz con nuestras familias, con nuestros seres queridos, y que siempre hay ayuda, y que el cáncer se puede prevenir si se detecta a tiempo. Entonces nosotras siempre hacemos hincapié en eso, los métodos de detección temprana tan importantes que son, y así es como vivimos, y lo hacemos por estos 4 o 5 años ya consecutivos. Muchas gracias.
Thank you so much, Patricia. This is just, it's really inspiring to hear your story and to hear what you're doing in the community. And that's kind of what we want to do in our group, is highlight the experts that are not only survivors, but are doing this work every day. Could you please advance to the next slide, Christy? And I know we have kind of a lot to cover, so I'm going to go over these slides quickly. And at the end, just give you an opportunity to connect with us. If you want to connect with Patricia's group, maybe we can add that into the chat if anybody's able to do that, as well as other ways to get in touch with us as we do the meat of the work in between these meetings. So just to talk about kind of echoing and piggybacking on what Christy had said in the beginning, this is an opportunity statement that we put together. We find very important for the Latinx community. So according to the latest CDC data, cancer is a leading cause of death, as we know in the state of Colorado. For Hispanics and Latinos in the US, along with heart disease, cancer accounts for about 2 in 5 deaths, a rate nearly equal that of all whites. Latinos are the largest, youngest, and fastest growing minority group in the US, and 142% increase in cancer cases is expected in the coming years among this community. So this kind of sends the urgency of why we are coming together as a task force under this important coalition work. Could you advance to the next slide? So these next slides that I'm going to talk about briefly talk about our mission, our vision, objectives, and activities. We are getting ourselves organized, trying to go along underneath the cancer plan, underneath the coalition. So these are all drafts. We wanted to get this in place, at least to give you a sense of our direction in case there's interest to join some of our efforts down the road. So our mission, we want to improve the quality of life for cancer patients and family members, both members and caregivers, through information, services, and resources for the Latinx and Spanish-speaking community. Important to say, regardless of immigration status. We support the idea of creating educational spaces by bilingual experts to raise awareness of early detection. We want to banish stigma, as well as reference to the supports in Spanish that exist in Colorado. And you can go ahead and advance the next slide. Just to add to that, we are specifically focusing on the Latinx Spanish community, but our hope is, as we look at stigma, we look at some of these issues, there is some crossover in other populations and other task force efforts, and we hope to continue to collaborate amongst the great work that you all have already been doing. Our vision is to centralize resources and possible interventions in a culturally and linguistically competent way. In order to eliminate cancer disparities among Latinx and Spanish-speaking community members, we want to create better access and equity in information and communication, and to ensure inclusivity by expanding the network of healthcare providers that are available in the state of Colorado. Go ahead and advance to the next slide. So these are our goals. We have 3 goals that we have put together so far. And again, these are going to continue to evolve, and we hope to execute these in the next year. To educate and inform the Latino community in Colorado about preventative diagnostic tests and cancer treatments, identify and share places that have equitable access for people who are monolingual in Spanish without legalized immigration status or health insurance. And our second objective is to centralize cancer resources that include prevention, treatment, support, recovery for cancer patients and their caregivers on a platform that is easy to access and navigate in Spanish as is culturally relevant. Next slide, please. Thank you. The third objective is to strengthen our support groups that already exist, as the one Patricia was mentioning, and support more regional health promoters to expand emotional support groups for cancer patients in geographic areas that require it. One group I just kind of want to put out, maybe you can respond in the chat, or this could be later in the networking session, but we want to look at research connections that already exist. We're not here to reinvent anything. We just want to build upon that great work. So just kind of want to put that ask out to the fellow members that are here today. If you could advance to the next slide, please. And then these are just kind of a summary of our updates for April. We're excited. We have an email address. Thank you so much, Christy, for working with our group and getting this set up and established. We are latino@coloradocancercoalition.org. So that is the best way to get in touch with us. As I mentioned, we had a draft of our mission, vision, goals, and objectives. We also conducted a pilot survey in the beginning of this year that I'm going to talk a little bit about. And then we're starting to get our action plans and activities together. So these are some proposals and activities. If you could advance to the next slide. So the goals, just very quickly, the goals of our research here, as you can see, we wanted to identify if the resources and services on the map that Christy was referring to and the coalition already has in place, as well as others that are shared, are up to date and accessible to patients in Spanish. Our methodology that we used, the 6 of us, we did telephone calls. We just made to different health centers and clinics in 6 different regions throughout the state of Colorado. Under the same questionnaire. And if anybody wants to look at that questionnaire, we're happy to share some of those questions, but this was a summary of what we did. We looked at financial aid, preventative diagnosis, cancer treatments, patient navigation, or health promoters who help in the process, coverage by zip code, among some others. And this is just kind of a summary, quick summary. Again, this is very pilot, very rudimentary at this point, but this gives us a good sense of how to direct our work. We found similarities of common challenges. There was a lack of knowledge, interest in general to the services that were offered. So depending on who you would call, sometimes that person, maybe it was the front desk, whoever answered, wasn't really familiar with the resources that were applicable to the population we were trying to seek out resources for. There was a lack of knowledge of another resource to refer. So let's say that clinic didn't have the resources for cancer patients. Was it in some of those areas, it was hard to refer out to someone else. I didn't really know where to refer. Basic tests were not covered, whether that was insurance or if they didn't have insurance, it was difficult to have access to those services for the Spanish-speaking community. The wait time to talk to someone, sometimes if you click that Spanish button, you'd wait several minutes, up to 45 minutes to an hour in some cases. And then, or you leave a voicemail and you didn't get return voice calls. There was not a lot of help or assistance for undocumented persons, and there was limited bilingual staff that could communicate in Spanish, among other issues. Now, we're again focusing on the Latinx Spanish-speaking community, but some of these disparities obviously probably aren't new to other members here and other populations, right? And so we're hoping to use some of this data to help other communities that may not just speak English at this point. Could you advance to the next slide, please? And then, so from this work, these are some areas that we'd like to discuss moving forward. And we want to look at to help fill these gaps. So identifying ambassadors that could really help navigate patients through the system of care, identifying Spanish-speaking leaders within healthcare settings, again, identifying health navigators in particular. We know there's a shortage and there's some technology that we're going to try to take advantage as a coalition. So looking forward to collaborating on those efforts. And then obviously continued collaboration opportunities within Task Force and the coalition as well as outside. The next slide, please. Activities and process. These are things, again, that we're in draft mode, looking to put these into action items. We're looking at putting together some breast cancer health fairs, educational talks on cancer topics, putting together a community health calendar or participating in a community health calendar that exists. For those of you, thank you so much, that have reached out since January, that are very interested in the task force. This is going to be of interest to you all. We are starting to develop committees that are going to open up so that we can really divide and delegate some of the work, as this is a lot of work that has to get done. So there are 3 committees that we have put together: organizing, administrative, networking and resources, promotion and dissemination. And then we're in the process of forming a volunteer committee based on data for partners and associated with the task force. We want to look at roadmaps that navigate basic resources, ideas for a Spanish consultation line. So we got some big dreams, some big goals here. Could you advance to the next slide? I think that's the last one. I know we had a lot to say here today. Yes, so just if you are interested in getting involved, we appreciate those that have expressed interest in your patients. We have been trying to get ourselves organized these last few months. I think we've done a pretty good job, but this work continues to evolve. Thank you so much, Virginia, for putting the contact information in the chat. If you want to talk afterwards, we will connect at a later time. Thank you, Christy.
Thank you. And I forgot, after the other task forces went, we'll start doing it. Does anybody have questions for the Latino task force, the Grupo de Cáncer en Español? And you can feel free to continue to put questions in chat. And then any questions for HPV or colorectal? All right. This, you guys are quiet today. So when we're getting close to the end, where it'll be time for partner updates and speed networking. So get ready to talk shortly. Okay, Debbie, you are up next for lung cancer.
Sure. It's a pleasure to be here and just hear about all the great work going on. Our task force, has been working very hard to try to increase the uptake of lung cancer screening throughout the state. That's kind of been our main focus the past couple of years. And we're going to be expanding beyond that some. Next slide. Oh, is there? Okay, so one of the things that we did do in the past few years, I think we've had 2 or 3 years worth of getting data from the all-payer claims database. So we actually got some funding through the Cancer Coalition, and we worked with the organization Civic to do a query of the all-payer claims database to find out data on the uptake of lung cancer screening and data on patients who have had lung cancer and so forth. So we've gotten a wealth of information from these all-payer claims database queries. And what we do plan to do in the next couple years is to focus our efforts on areas where we know that there is the biggest need. And that does seem to be in the rural areas, but also just some underserved areas in the metropolitan areas of Denver and the Front Range. So we, as our goals, one of the things we're going to be doing is trying to increase education and awareness about screening and overall lung cancer, and try to get more patients referred in for screening. And then as sort of an offshoot of that, one of the things that we've just been talking about within just like literally last week's task force meeting, I think we're borrowing some ideas from other task forces, is that we're setting up work groups. And right now we're thinking our work groups will have one on lung cancer awareness for both patients and providers, one on biomarkers, one on survivorship, one on screening, and we already have a work group or subcommittee on radon. The other thing that we know that there's an opportunity for that we just haven't done in the past is to partner more with CDPHE and the tobacco control folks and see what we might be able to do as far as working with them on smoking rates and just overall general tobacco control. And then kind of back to the screening idea, one of the things that we also could do is we've tried very hard in the past couple of years to bring the different screening programs to the table and have representatives on our task force from the various programs around the state. Sometimes it's an oncology nurse, sometimes it's pulmonary medicine folks, sometimes it's radiology, but there's like a whole group of folks that we want to be able to bring in. And so we want to expand the membership on our task force, and we have had a hard time getting primary care. We have had a representative from Kaiser, primary care physician there, but we haven't been able to get primary care from other areas really. We would like to get a representative, an oncologist. We do have a surgeon that we have connected with in the past, and we hope to bring them sort of back to the table. So I think we continue to build the membership within our task force, and we know that there's just so much to do. Sometimes it's kind of overwhelming, but we know that, you know, we just have to get the right folks at the table. And if we can adopt this work group idea, I think that we'll be able to maybe spread out the workload a bit more. In the past, we've had 2 very successful, I would say, annual symposia webinars that we put together in 2020 and 2021. And we really tried to focus those predominantly on screening. They were successful, but we are going to take a new approach in the next couple years where we're going to basically say we're going to take it to the providers rather than expect the providers to sign on and participate in our webinar. With some of the geo-targeting and knowing with the all-payer claims database where the greatest needs are, that we're going to be able, we want to take, kind of almost do a road show and take it to the providers in the rural and frontier areas. There's a couple of areas that we've looked at partnering with. And then also, as I mentioned, doing something more locally, perhaps in Denver, in some of the underserved communities and federally qualified health centers. So it's just a huge opportunity from here. I just kind of keep looking at it that way. We're just very excited about the cancer spectacle at the state fair. We've already had several folks within the Lung Cancer Task Force say that they would like to participate in that. So that would be very fun. And then also to do something like the Colorectal Task Force did with at the state Capitol, have a lung cancer day, and we think that might build some enthusiasm and interest among our membership as well. So that's kind of in a broad overview. Happy to take questions.
Any questions for Debbie? Thank you, Debbie.
Sure.
Okay. Emily, are you on? Let's see. Okay, I don't see Emily or Rachel. All right. So the Navigation Task Force, this is another task force that is coming back. We used to have one a few years ago, and we're bringing it back now because of such a great need for growing the workforce and providing education and networking opportunities for the navigation and community health worker space. They meet the 3rd Monday of the month from 10 to 11. They are working on trying to figure out if there's a navigator database out there. This would be more for the professional side, for them to be able to refer patients back and forth. So they're looking into that. They're bringing back the Navigator Night Outs. The first one will be in May, and those always sold out instantly. So stay tuned when we have that registration up. Those always have an educational component as well as great networking opportunities. And then their other goal is going to be to help drive more traffic to the chatbot and just make sure patients are finding the resources they need when they need them. Any questions on the Navigation Task Force? All right, Skin Cancer Task Force. I think I'll be providing that update as well. Our Skin Cancer Task Force, as I mentioned earlier, is getting back on the road, doing some events. So their goals here are increasing their membership and diversifying their membership, and providing sun education programs at a minimum of 2 schools, and helping get the sun bus out there doing more events. I know the sun bus has been on the road a lot outside of Colorado, and they're actually looking at possibly getting a second bus. So hopefully we'll see a second sun bus coming sometime soon. And they'll be participating in the spectacle at the state fair, and they'll have dermatologists on board doing skin checks at the state fair. Some of the other things they're working on, I mentioned that Farm Safety Day. They'll be doing some sun safe education out there. They're also presenting to some middle schoolers at Falcon Bluffs Middle School. They're doing a wellness day, and so they'll take the Reveal Imager to the wellness event and do some presentations on sun safety for middle school age. And then Deborah Hess is here on the call. I know she's got a lot of events planned in Grand Junction to take the Reveal Imager out. Deb, do you want to share your Sign Up Genius link if you have it ready, or we can send it out later?
I did go public with it just a little before this meeting started, so I'm not at that point yet, but I have 7 days in May. And then I also have days in June and July where I'm going to do free screenings here in Grand Junction to the general public.
Awesome, thank you. And correct me if I'm wrong, Deborah, but I think you single-handedly did like 800 Reveal Imager screenings one year, right?
Actually, it was over 1,000. It was about 1,100.
Okay.
In one season, yeah.
She's a force out there in Grand Junction, making sure that they are practicing sun safe habits and seeing that knowledge change and that behavior change. So thank you for all the work you do out there. The next Skin Cancer Task Force meeting is May 6th. And if you're interested in joining, email skin@coloradocancercoalition.org. All right. Next up, we have Bonnie to give the Survivorship and Palliative Care Task Force update.
Perfect. Thanks, Christy. Hi, everyone. My name is Bonnie Herman. I'm a licensed clinical social worker, currently working with Rocky Mountain Cancer Centers, and recently joined the Survivorship and Palliative Care Task Force earlier this year, co-facilitating with Carlin. So we have 2 goals that we are working on to increase the education about the unique mental health needs of cancer survivors, and also increase the access and sharing of resources among healthcare professionals to be able to increase those supports for cancer survivors. And then to increase the knowledge and understanding of palliative care, and to build on the work that's already being done across the state of Colorado to help increase access, especially for rural areas outside of kind of our more urban areas that provide a lot of the palliative care programming here. Next slide, please. Our next meeting is Wednesday, May 4th from 12 to 12:55. We recently kind of switched back to Wednesday meetings. And certainly we are looking for additional folks to be able to join us. We are going to be developing a couple of task force work groups to help implement and develop our goals further, our specific action plans related to palliative care and survivorship. So happy to answer any questions, or if anyone wants to reach out, we'll just be happy to provide any other information.
And I'll put a plug into National Cancer Survivor Days coming up on June 5th.
Yes.
And so we'll be sharing any Survivor Day events that we hear of, as well as we'll have a presence at Red Rocks Medical Center for their National Cancer Survivor Day event. So look for opportunities to share those, as well as come to those and help staff the CCC table. And so, yeah, so stay tuned for that and put that date on your calendar.
Thanks so much.
Yeah, thank you. Any questions for survivorship? Okay, I'm going to try to speed through the next stuff so we can really get to time for networking. We hosted the first breast cancer roundtable conversation this week, and it was a great discussion. There's a lot of interest in bringing back the breast cancer task force in some form. And so we're meeting again on May 16th, and we already have that set up. So if you want that calendar invite, send me an email and I can add you to that calendar invite for the breast cancer roundtable to continue those discussions. And then some other updates. So most of you probably know Becky Seelig. She is unfortunately leaving her role at CDPHE, but she's going to fight CRC, so she's not going too far. I'm hoping that we can still have her involved with the Colorectal Cancer Task Force. But we've been so lucky to have Becky the past 6 years. Without her, we would have not been able to host the annual symposiums, and write the cancer plan and do all of the work that we've done. She's been integral in helping make that happen. So thank you, Becky, for all of the time you've given and the support you've given to the coalition. You will be very missed, and hopefully we'll still get you involved in the Colorectal Cancer Task Force. Do you want to say anything, Becky?
Just thank you for that. And yeah, it's been great to get to work with so many passionate people in the state. And I think today's meeting is a testament to that just so much going on. And it's been an honor to work with everybody. And I look forward to working with many of you in my new role. So thank you.
Thank you, Becky. Okay, a few more updates. Tax season is officially over, but if you're filing late and expecting a refund, you can still select the Colorado Cancer Fund on the voluntary contribution form. So please keep that in mind. It's it's our second biggest income source. So this is what helps us fund task force work and other cancer plan implementation throughout the state. Just wanted to highlight ways to get involved. If you've been hearing about all the opportunities, so you can join the board of directors, you can join any task force, you can help plan the cancer spectacle, or any of the other goals that you saw the task forces talking about. There are so many ways that you can get involved and help move us forward. I want to put in one last plug for the Cancer Experience Registry. This is through the cancer support community at a national level. They're trying to get as many responses as they can from Colorado, from caregivers and survivors, so that they can just get as much data in Colorado to help inform support programs that are offered here and see what gaps there are and things like that. So once they get enough of a response, they should be giving us a report out of what they found. So this can help inform our work and help us better meet the needs of survivors and caregivers. It's a pretty lengthy survey, but it hopefully will give us some good information down the line that can help inform the cancer plan. Okay, and then we're gonna start putting in all of our newsletters all the task force meeting times so that you can all be reminded of when the task forces are meeting. Some of them meet monthly, some meet every other month. We have some upcoming peer sharing. So we'll be going through what links of care is during May. Sorry, I didn't put the date. That's May 18th. And then in June, we'll be doing a toolkit showcase showing evidence-based cancer screening, messaging, navigation sustainability, as well as some genetics and family history toolkits. And then we have a few different events where we're gonna have tables. So get your rear end gear on June 5th. That I think is in the morning, I'm not sure of the time. I mentioned this National Cancer Survivor Day, also the Walk to End Colon Cancer, and then our next Summer Cancer Partner meeting is July 26th. So lots of opportunity for face-to-face coming in June, which is really exciting. Okay, let's do really quick partner updates so that we can get to the networking time at the end, which I know everybody loves. So if you have, oh good, Karen put in the chat that get your rear end gear is from 7 to 12. So thank you, Karen. If you have updates, so events, educational opportunities, things like that that you want to share, just go ahead and come off mute, or you can raise the little hand function. But if you have an update, go ahead and share it now, please. Nancy, okay, I see. Go ahead, Nancy.
Hi, this is Nancy with Epic Experience, and we're super excited. We are launching our virtual reality program called Thrive VR at our gala on May 14th. And we're going to open up early if anybody's in Denver. And if you want to join us at the gala, great. But if you want to just come by, I'll put my email. And if you want to check it out, we're really excited about this program. It's videos talking the cancer language right to patients. Doing camps is what we normally do. So we're taking it virtually to people in the hospitals. So that's what we have going on. We have camps coming back this summer. So that's super exciting. As always, we have exercise twice a week, free of charge virtually for survivors, and an amazing podcast with a great lineup of discussions.
Awesome. Thank you, Nancy. Arn, I see you next.
Hi, everyone. I'd like to introduce myself as the 2-day-old executive director of Live by Living. We were founded in 2008. We've got hikes starting online at livebyliving.org. Also would like to partner with the people who are either at treatment centers to find more people, and we're looking for volunteers, but would love to plug in with you. I ran a 20-year-old national outdoor sports charity for kids called Sos Outreach. My email is arn@livebyliving.org, and I'm seeing some of these questions and would love to work with hikes that we have going on, and our overnight hut trips, and also our online meditation and yoga classes. Hello, hi.
Awesome. Thank you, Arn. Welcome to 2 days in.
It's an honor to be with all of you. It's quite an amazing organization. Thank you.
Thank you. All right, Bridget.
Hi, I am Bridget with Project Angel Heart. For anyone who's not familiar, we do free home delivered meals for anyone with a life-threatening illness. We do ask that the application be completed by a healthcare provider. I have 2 quick updates for you all. One, we are now officially delivering in Pueblo. So if you have any patients in that area who would need the meals, feel free to send them to us. I'll include my email and our website link in the chat after this. Secondly, for anybody living in the Denver area, this Thursday, the 28th, we're having our Dining Out for Life event. I'll send a list of restaurants. That is for if you guys want to treat yourself to breakfast, lunch, or dinner at any of those participating restaurants. We will get a portion of their funds for the day. So if you want to, have an excuse to dine out, this Thursday is the time.
Great, thank you, Bridget. And that's exciting about expanding the service area. All right, Karen.
Hi, I'm Karen Wilson. I'm working on the Get Your Rear in Gear race. So if anybody wants to volunteer, just, email me. But I also wanted to promote, and we'll get the link to this flyer, a fundraiser on May 2nd at Panda Express, any Panda Express in the United States. But you order online and you enter a code, and they will give us 28% of the sales, and all that money goes to buying fit test kits for the underserved areas in Colorado.
Great, thank you. Does anybody else have any other updates? And as always, you can email us at info@coloradocancercoalition.org. And Liz is actually putting together a process for you to submit information for newsletters going forward, for newsletters and social media. So send us, we're happy to share anything. So send it our way. All right, so I just linked in the chat the evaluation form. Please, when you're done here today, take a moment to fill this in so that we can make sure that these meetings are meeting your needs and make them as effective as possible. And then now on to the speed networking. So I see on here that we have Autumn. Autumn, do you actually want to raise your hand? Autumn and Taryn and Ashley, do you guys want to use the raise your hand